So how much water should we be drinking to prevent and reverse heart disease? This is Diamond Fernandez here with the Heart Fit Clinic, and I'm excited to talk to you about water because water is such an important thing that, we see so many people ask me this question, okay, well, how much water should you drink? Well, I think the most important thing to realize is that your body is mostly made up of water. And so when you understand that, uh, there's a calculation that we do in our clinic that looks at water content inside the body, and when you don't have enough water, that can cause a problem. So every cell, tissue, organ in your body, it requires water to work properly, and so it's critical to your heart health. And your heart is constantly working, and it's pumping. It's not really a pump, and that's another blog post, but it's pumping about 2,000 well, it's gallons, so, and of course we're liters up here, so it's about close to, let's call it 8,000 liters a day, which is quite a lot. And so staying hydrated is very important. That's by drinking more water than you are losing, you're helping the body or the heart to minimize its pressure that it has to work to. So dehydration, let's talk about that for a second here. So dehydration can negatively affect the heart, and it just causes the heart to work harder, and your whole cardiovascular system. So your whole cardiovascular system works together. And why, I'm just going to quickly go back a second and talk why the heart's not a pump. Imagine your heart in the one beat, it's got to bump all the way out to your fingertips and come back all to your heart, return venously, all in one pumping motion. So it's a whole cardiovascular system that works together. So it's very important. So if you're dehydrated in your blood volume, which can affect the amount of blood circulating through your body, it can cause your heart to be faster. My apologies. It can cause your heart rate to increase blood pressure. So these are big things, and when you have and sodium, we know is a big thing that unfortunately we get too much in our diets. But if you are not drinking enough water, then sodium gets used up in a negative way in your body, and so it thickens the blood. It makes it harder for the blood to circulate in and around the body. So keep your heart hydrated. Keep a lot of water hydrated in your body. So that's the most important thing. I also want to talk about if you're thirsty, it's too late. And so you should be drinking. I always like to say, get into habits throughout your day. And I think habits are very important. So you can bookend, if you got busy days, that's fine, but bookend your morning and bookend your evenings. And those are the things that you can get into habits of drinking water. So how much? That comes down to the question, how much water? I can talk a lot about water. In fact, we've got a whole talk, a whole presentation just on the importance of water. But anyways, for this purposes, for women, it's about 12 cups a day, and that helps out for the women's side of things. Just men, because they usually have larger bones and blood volume in hearts as well. It's about 16 cups a day. So respectively, that's about 2.5 liters to about 3.5 liters of blood. So women a little bit less than men. And so that's how much water we should ideally be drinking. But more importantly, it's important to get you can just get at one of those scales where it can tell you how much water content you have. It's one of the things that we do here at the clinic. And anyways, I'm happy to answer any questions, comments, or observations. But if you definitely want a talk, make sure you finish. If you want more information on what we do, contact the clinic. We've got the Heart Fit University that will help you out with all the more detailed information. So I know this video is going a little bit longer because it's something I'm very passionate about, and make sure that you drink enough water. Anyway, Diamond Fernandez here with the Heart Fit Clinic, when we help you live happier, healthier, and longer.